Hi, Ray.
Hi, Gina.
Thank you so much for doing this recording so all the students that have just finished reading your book can meet you, which I think is really terrific, and also get some insights from the author, we'll call it.
Well, thank you. It's great to be with you.
Thank you so much. So I'm wondering if maybe you could give these folks a brief overview of where your career has been and where you're going, and also what is it that prompted you to write this book?
Sure, thank you. I've been in this industry for about 40 years now, healthcare management, and I came into it. The first major chapter of it was as a consultant working for Ernst and Whinney, which turned into Ernst and Young. That was a pretty significant merger while I was there. I did that for a number of years. I then went to the new thing at that point in the 90s, which was managed care and HMOs, and that was the shiny new toy. And I was there for a long time. Just so happened that the organization I worked for, Harvard Community Health Plan, merged with Pilgrim Healthcare. Harvard Pilgrim Healthcare had a very significant uh, kind of fall, rise while I was there. I learned a lot. I became accountable for a major division that went through a turnaround. And in many respects, that set the tone for the rest of my career. I learned a lot about organizations that were right up against it and the many important good things that happened in order for it to ultimately succeed and to return to its former state, which was the number one rated health plan in the United States, even though it came that close to going out of business. I learned a ton from that. And then from there, I decided that since my entire career, 20 years to that point, was with organizations going through profound, even existential change,
Hmm.
that was going to be my thing. And so then I spent the next 20 years doing that. I have a consulting practice now, and I work with mission-driven not-for-profits, as I like to say it, that are going through change, making significant decisions, trying to meet their mission. And so that's my career. Um, to answer your question, what prompted me to write the book,
Hmm.
I remember a very distinct moment, probably 2017, 2018, when I was working on a pretty significant turnaround. And I can remember literally the moment that it hit me that many of the things I was encountering in that roughly $25 million organization were quite similar to the things that I had seen when I was back at Harvard Pilgrim, which was at that time about a $2 billion organization. And
Wow.
so I started to think about, well, what are the similarities? Now, $25 million organization, a $2 billion organization, the scale, the nature of the politics, sort of the complexity of the chaos, they're going to vary. But at the core, there were some very striking similarities. And I can remember opening up a note on my computer in the whatever software I was using back then. And I just started writing down notes about what were some of the things that were similar. And a pattern began to emerge. I didn't realize it at the time, but I was beginning to put together an outline for what would become the book. And so that's the answer to your question. What made me think of writing the book? Um, I was struck by, $25 million, $2 billion organization that um, there are a lot of superficial problems in an organization that's struggling,
Yeah.
and turnarounds and transformations that get down to the root of the weed as opposed to hacking off the surface. If you don't get down to the root of the causes of those problems, then your solution is going to be short-lived. And I saw that over and over again. The other thing I thought about was, in the organizations that I had experienced successful transformations, I started to compile this list of like, well, so what were the characteristics of the organizations that successfully transformed versus the ones that didn't? And I thought
Wow.
about all the stuff that you
Yeah.
normally think about, like balance sheet strength and competitive, favorable competitive dynamics and quality and customer service, high marks. And I
Mm.
just put together all this stuff, and three things came up over and over again. the organizational culture,
Okay.
the the mission,
Ah.
and whether or not an organization was internally focused or externally focused. And I sort of lump externally focused, meaning on its patients, customers, clients, whatever, um, as defined in their mission. When that was a principal focus, that seemed to be a characteristic of the organizations that could elevate out of their, chaos. And then
Mm.
finally, and this is the most obvious one of all, was leadership and the
Yeah.
characteristics of leadership. And so um, eventually that note turned into an outline, which turned into the book.
Wow. You know what's so interesting as you're speaking about this, you were talking about your career starting in the 90s and the evolution of your career and all these different organizations. And yet here we are, healthcare is got some of the biggest challenges going still, right? So in your book, I love your description of these waterfalls, right? And so we're speaking today, the students here are healthcare leaders, healthcare staff, future leaders, future CEOs. So they're probably already experiencing waterfalls right now because they work in healthcare. So there's no avoiding of it. And then as we look to the future, how our industry must change. And who knows what, we don't know right now. You look at AI and other things that will completely transform the way we act and behave in healthcare. So it's so interesting because you were working with waterfalls and all those issues way back in the 90s, and here we are today. We still have waterfalls. And so I'm wondering, talk to us a bit about as leaders of healthcare. What do you suggest? What have you learned over your own career and what's in your book related to being a leader and managing your behavior and organization as you are facing a waterfall?
Sure. Well, I'm far from the first person to use the waterfall analogy of sort of being up against the edge of one and the relative peril that presents. But in my book, the part of that metaphor that I was most drawn to was the fact that the leadership challenge when you are up against the edge of a waterfall is
Mhm.
quite different from when you're not.
Mm,
And that's the obvious part. But what I was interested in was that there are still significant challenges when you're not up against the edge of a waterfall. And so I've got this whole section in the book, and the publisher put a picture on the cover of the book to reflect this. But this sort of idea that there's always waterfalls.
yeah.
And if your mindset is that there's always a waterfall and that you have to be on the lookout for them and you have to manage accordingly,
Mm,
that there are valuable lessons there, and that's part of what I go into. The
yeah.
the second part of the book, which is the sort of coming out of, like what are the steps to building your culture?
Yeah.
I think, to get to your question about like how do you handle these challenges? I mean, the there's a lot that I could say here, but I think the two things that come to mind and I'd put at the top of the list are there's never a substitute for effective leadership. And I talk about what that means. Part of it is teamwork,
Mhm.
part of it is building trust. And when there's trust within a leadership group, you can vet opposing viewpoints safely and
Mhm.
comfortably, and
Mhm.
you can challenge your thinking. This is incredibly important. And there are a lot of dynamics that can happen, usually that stems from the personality types of the folks in the leadership group, typically the CEO,
Yeah.
that can prevent that from happening. And I use an example in the book that to me is particularly telling is that when I was serving as an interim CEO of an acute care hospital and there was a significant negative event that took place in that hospital's OR, I was part of the group that was listening to the surgical team, and they were talking about the culture that was created by the surgeon in his surgeries. And it was a culture of fear. It was a culture of not questioning authority. And that as this event was taking place, everybody else in that OR understood that things were going sideways, but they couldn't bring it up comfortably.
Wow.
and there was a negative event. And so, among other observations that I had from that experience, I said to myself, this happens in management groups all the time. And so
Yeah.
having an effective leadership, extremely important. Secondly, I think, clear and transparent communications with employees builds goodwill and, again, trust. I think trust is the currency of effective organizations. And I
Okay.
think you do that when you're not up against the edge of a waterfall. And
Mm.
I can tell you that you're going to need to spend that currency when you find yourself up against the edge of a waterfall. And there's a lot you can do with it. If you don't have that and you get up to the edge of a waterfall and your employees are not feeling confidence in leadership, not feeling trust, may even say to themselves, I tried to warn them. I wanted to warn them. They're the ones who got us into this mess in the first place. Now that that captain of that ship is issuing orders when
Mm.
you need to be acting as a effective crew on that particular ship, if you haven't built a reservoir and you haven't built up that currency at that point in time, um, your job is twice as hard. And so, how do you do that? Clear, transparent communication, the kind of communication where you can level with folks. And, this is something that I write about, and in my podcast, I talk about this, which is that employees, especially today, and I would differentiate this from the 80s and the 90s when I was
Ah,
starting out,
okay.
is today people have higher expectations of
Agree.
understanding what's going on in a
Hmm.
company. I describe this as the context curious.
Hmm.
Um, Today, everyone's used to devices where you have instant access to information, and we have social media where everybody's got a podium and a spotlight, and we are different today than we were in the past, and so people have higher expectations. And so when you're in the audience and you're looking at people at the front of the room, you can detect lack of transparency. I think people are more sophisticated, frankly, than when I was starting out.
I
Um,
agree.
and so leaders should lean into that.
Yeah.
Don't buck that trend, ride it. It's not only good in terms of building trust, but boy, it's liberating to be able to say it and to put it out there and just say, look, this is a tough decision. We have to do something hard. Here's why I made the decision.
Hmm.
I've had many experiences in my career where people will hear that and they'll go, okay, I don't like it, but I get it.
Yeah.
Better that
Yeah.
than walking out of a room saying they're all idiots.
Right.
They're all bad. They're all wrong. You don't want that.
I agree. When you think about what if a culture of chaos, one of the best ways to tackle it is through transparency. Put it out there. What is appropriate to put out there? I so agree with that. You and I have talked before about servant leadership, and one of the tenets of servant leadership is this idea of a relational bank account. And it's the 80-20 rule, right? If you want folks to hear you all the time, good, bad, ugly, you got to deposit quite a bit of good stuff. That's the trust in order for that 20% of when things might be going sideways to have people with you. And I think that's really important. And that comes down to being vulnerable, at least in my opinion. Lencioni has a great book, Five Dysfunctions, and trust is at the center of it. It's the baseline. And if leaders can be vulnerable with their staff, meaning, and I always say, all right, you don't need to tell everyone your deepest, darkest secrets. That's not vulnerable. However, say, I'm human. I have strengths, weaknesses where you have strengths. This really builds a culture of strength, and that I think really helps with this idea of trust, especially when there are quite a few challenges. I mean, the staffing challenges today, Ray, they're remarkable, right? And they really impact every facet of the organization. I mean, that's one issue that, everyone listening to this and watching this are experiencing right now, regardless of their setting. I don't know what else you might say. I was wondering what you might think about organizations that, okay, we're on the lookout for these waterfalls and maybe we get through one. Okay, now what? So in your book, you talk about the in and from chaos. So how about talking to us a little bit about that? We need some hope.
Well, here's some hope, but just
Okay.
kind of going back to your comment about, hiring staff and some of the challenges in
Yeah.
healthcare. I mean, it's a bit of a pendulum. It kind of swings from side to side, and there can be critical shortages, and things are worse than I remember. And the pandemic didn't help, obviously, but um, there was a time whenever management teams got together and to talk about employee engagement, and you look at retention and turnover stats and so forth, and 95% of the conversation was pay and benefits, pay and benefits, pay and benefits. And the data is clear that today the transactional stuff, I don't want to diminish the importance of that. That is important, but people are looking for culture. They're looking that, people are even looking for meaning and purpose in their work, and
Yeah.
that gets into the culture. And so, um, employee engagement initiatives that are purely focused on transactional are missing the boat, because look at the data. Look at what people are saying when they leave a job and the reason they leave a job now.
Yeah.
I think that's pretty compelling.
I agree. And what about leaders? So we talk a lot about retaining our staff, but what about retaining the people that report to us, the emerging leaders? We talk a lot about succession planning. I mean, what is it from all the lessons in your book? And again, in and out of chaos. What is it that you think, if there is anything different that matters to leaders of organizations in times of trouble?
Yeah, that's a really great question, and that gets into issues of succession planning, which is not a topic in my book, but it is a topic of something that I've thought a lot about. And you and I have had many conversations
Yeah.
about that. Um, the question is, what do those leaders want? And leaders in the 80s and the 90s would answer survey results about what they're looking for differently than leaders today.
Mm,
And there was a heavier weighting towards job stability, towards upward mobility and those sorts of things. Today, a lot of leaders are looking for flexibility, and they're looking for an ability to contribute in other ways, and so forth. So much like what I mentioned earlier about how employees in general have a different perspective on jobs than they may have in the past,
yeah.
leaders are employees too, so they do as
Yeah.
well. But what they're looking for in their career, it's important to understand, and I think a lot of this goes to your recruitment of your leaders to
Mm,
begin with. A lot of my clients right now are looking for leaders. There seems to be a higher degree of CEO turnover than in the past.
okay.
It's like managers of baseball teams. We seem to be in a time when there's a lot of compression. There's
Okay.
the tenure of CEOs is less. That's
Yeah.
not all because of owners firing the managers. A lot of it has to do with the managers themselves wanting to move on. And so I think understanding what people are looking for when you're doing your hiring is
Mm,
vitally important. And I
mm,
think the development of succession plans, not just at the CEO level, but for all leaders, has to be a lot more sophisticated than it was in the past, because A, people are looking for different things, and B, if your succession plan is all about management training, this happens all the time, is that someone will go through your management training, and then just as they're coming up and ready to take on the next challenge within your organization, someone comes in, a recruiter will call them and pulls them out to another organization.
yeah.
So it's a
Yeah.
complicated thing.
Yeah.
In terms of hope, though, and
Yeah.
like kind of the way out and so forth. I mean, I think that leaders need to demonstrate active listening. And on the surface, this sounds like a total statement of the obvious, but we all listen. But I think better leadership groups demonstrate active listening.
Mm,
And one of the examples that I use in the book is, employee surveys, employee satisfaction or engagement surveys, is that, most organizations, if not every organization, does them. They compile the results either
mhm.
themselves, or they have they work with some company to help them with that. and they get the results, and then they frequently will report those results and may even say some things about what they're going to do about it. But boy, 90% of the time they fizzle out into nothing.
Yep.
And it's better to have to me, active listening happens when a leadership team will reflect on what they heard, won't just put the graphs up on the wall behind them, but they will actually say, this is how I feel about this. And I can't do everything, but this is what I'm going to focus in on. And then focus in on that thing and deliver. That to me, that's a form of active listening. It also is a form of demonstrating vulnerability, servant
Mm.
leadership, as you mentioned, Gina. But I'm a big fan of leaders who will answer questions, sort of very simply with a like, this is what I know. This is what I don't know, but what I'm doing to try to understand better. And this is what I can't yet talk about, and here's why. It's just there's a simplicity to transparency. I think that's really important. I think another thing is, clear definitions of success.
Ah.
I talk about this in my book, but I can't believe how many times I've come into an organization and I separately interview key people and I say, well, like, what is the definition of success? What are you striving for? What's the difference? And it doesn't happen all the time, but it happens often where you gather up such different answers to
Mm.
definition of success that it just tells me you got people in that boat where like this person's rowing that way, this person's rowing that way, this person's
So
rowing that
true.
way, and
Yeah.
that's not good for anybody. Tracking value,
Mm.
making sure you're clear about your vision and your storytelling, the mission, and you're orienting people towards your mission
Mm.
because your mission, if well told, well described, can be very compelling, it can be unifying, it can be inspiring, it can be meaningful, it can drive people towards feeling that sense of purpose that people in the 2020s are looking for, where the people in the 1980s and the 1990s didn't, or they didn't know they were, whatever.
Yeah.
Again, people are very different today. I think leadership that can make the mission real
Okay.
and compelling will be something that better organizations can do to improve themselves and to make themselves more durable
Mm.
for the inevitable waterfalls that are coming down the line.
Yeah, that's a great point. And you would think in healthcare, regardless of the setting or the role you play or where you work, whether you're a provider, a payer, or something else, we're all in healthcare. And so the mission there is a great story. I think that's a wonderful point. And I before we close, I want to make sure that we talk about your podcast. You mentioned it. So tell us, how do we find it?
Well, my book is called Saving Organizations That Matter. And when I talk about this to an audience, I tell a funny story about how that was not my first choice for the
Yeah.
name of the
Okay.
book, but the marketing people at the publisher wanted it, and they said, "Oh, it's good. Believe us, believe me, it's good." And I kind of went along with it because they convinced me that it was a good title,
Yeah.
and it has grown on me over time. And so I decided when the time came to do a podcast that I would call it Leading Organizations That Matter. So I have this Organizations That Matter thing stuck. It's called Leading Organizations That Matter, and it's on YouTube, it's on Apple Podcasts and Spotify and every place where there are podcasts. And I'm only about 20 episodes into it, but so far they have been like 5 to 10 minute weekly snippets
Mm-hmm.
on topics much like what we're talking about. I have a number of guests lined up. And so about every fourth episode is going to be someone who works at an organization that matters or who has particular insight or specialty that is relevant to this notion of mission driven, not nonprofits,
Mm-hmm.
whether it's in the behavioral health realm or it's in the community health center realm or just healthcare in general. So I got them all lined up. We're going to be doing
Good.
interviews, and that's Leading Organization That Matters. Thanks for asking about it.
Yeah, of course. And I would say the lessons that we talked about here and in the podcast and in your book and all, you don't have to be a not-for-profit mission-driven organization to learn from the lessons. I know this is your wheelhouse and where your passion lies, but the truth of the matter is leadership is leadership, is it not? Now, there's different nuances, of course, with what our stakeholders might be. But I would say to everyone listening to this, you can learn a lot, even just open up your mind to different people, and it's no cost and it's available to you. So, Ray, thank you so much. This class really, we take advantage of your book and that we get our discussions going. And one of the first focuses we have is on a toxic culture because it's too easy for that to happen, right? And so even if you're not in it, you want, as a leader, want to be aware of it. And I'm really glad that we actually touched on that as well. So I want to thank you again so very much for joining us. I love that we've been able to talk with you so that people can put a face with a name in your terrific book.
Thank you very much, Gina. It's been a pleasure talking with you, and I appreciate your including the book in your course, and I'd be happy to help you or any of your students any way I can at any point in time.
Oh, that's really great. Well, how about sharing your website then? We didn't do that.
So the name of my consulting practice is Red Sail Advisors. Red Sail, as in the sailboat. That's again the
We have a
waterfall stuff.
theme.
So the theme, redsailadvisors.com.
RedSailAdvisors.com. Got it. That's great. Thank you, Ray.
Thanks, Gina.